in this video, we are going to be talking about breast cancer awareness. Now, we are still in the month of October, which is the breast cancer awareness month. So we can still talk about breast cancer. Now, what is breast cancer? Basically, breast cancer is the cancer of the breast. Now, what is cancer itself? Cancer is an abnormal cell growth that can be found in any part of the body, which can spread uncontrollably. There are the benign growth and the malignant growth. So the types of breast cancer, which is the invasive and non-invasive. The invasive is simply the abnormal cell growth which has gone beyond the breast tissue and also the nipple. While the non-invasive is the one that has not gone beyond the breast tissue or the nipple. So let's go quickly into the symptoms of breast cancer. What are the symptoms of breast cancer? Number one is swelling and lump on the breast. Now, when you are doing your self-breast examination, just take your hand around your breast and palpate to know if there's any lump or swelling. So I'm going to give an example of how to check for this lump in the breast. Now, for example, if this is the breast. So, for example, if this is the breast and you have palpated around the nipple, you also palpate the areas around the nipple and the nipple itself. So, after palpating, if you notice anything like this, let me show you. So, if you notice anything like this around the breast, probably you are palpating the areas around the breast and you notice any lump, maybe something is swollen inside the breast. So, when you are palpating it, you will feel a hard substance inside. That is how you know that, okay, this could be a sign of breast cancer. Or let me quickly ring my doctor and, explain to the doctor about it, or go to the hospital and quickly get yourself checked. Okay, I guess this is a good explanation of how the lumps look. The lump could be found around the nipple, just like this. You see the way this looks? The lump could be found around the nipple, just like this. So this is a good explanation of how the lumps look inside the breast. So how it looks inside the breast. Okay. Having said that, another symptoms of breast cancer is discoloration around the skin of the breast or the nipple. So when there is maybe reddish discoloration or yellowish discoloration, that could be a sign of breast cancer. Or when there's rash around the breast or the nipple, or when there's sore or ulcer around the skin of the nipple or the breast, that could be a sign of breast cancer. Now, another symptom is discharge. When there is, colorish discharge or blood discharge, from the nipple, that could be a sign of breast cancer. So, another symptoms of breast cancer is pain. When you are palpating the breast and you feel pain, or when you are just feeling pain, even without palpating, that could be a sign of breast cancer. So, you need to go to the hospital to get checked. So, when there is change in the size of the breast, or when there is change in the shape, that could be a red flag of breast cancer. Okay, when you notice any of these signs, just make sure you head straight to the hospital to quickly get yourself checked. Now, there are some series of tests you can carry out to detect breast cancer. That is basically done in the hospital, which is the mammogram, which is the x-ray of the breast. Yes, a mammogram can be carried out on the breast to detect any abnormalities or any cell growth on the breast. Now, there is breast MRI, which can also be carried out to check for breast cancer. The doctor can also carry out a blood test on you just to know if there's any abnormality. And also, there is biopsy, whereby a sample of cells can be taken from the breast to know if there's any abnormalities around the breast tissue, just to to be able to detect breast cancer. And then, lastly, there is predictive genetic test, which can also detect breast cancer. Now, after carrying out this test, for example, probably they now detect an abnormalities around the cells, or probably they now detect that, oh, this person definitely has cancer. Now, what are the treatments for cancer? Number one treatment is chemotherapy, which is the use of drugs to either kill or shrink cancer. So the next one is radiation therapy, which includes the use of high energy rays to kill cancer. Now, the next one is biological therapy. This works with the body's immune system to fight cancer. The next one is surgery, which includes the partial removal or the complete removal of the breast through an operation. Lastly is the hormonal therapy. This involves the prevention of cancer cells from getting the hormones they need to grow. So any of all of this can be used to treat cancer. And mind you, cancer develop over a period of time. Having said all of this, if you want your cancer to clear off sharp, sharp, go and visit NSPPD. What God cannot do does not exist. Oh, don't say I did not share you updates. Anyways, at this point, if you have not followed, follow, like, subscribe, please, so that you will get updated on every information I share on this platform. Now, what are the causes of breast cancer that is making people to, go for hospital and say, okay, they've been diagnosed of cancer and they have started, treatment? What are the causes of breast cancer? Basically, the cause of breast cancer is idiopathic, which is unknown. Yes, they haven't really found a definite cause for breast cancer. However, there are risk factors of breast cancer, which includes a combination of genetic factors and environmental factors, which includes age. Yes, the risk of breast cancer increases with age. The next one is family history, genetic mutation, hormonal influences, breast density, that is the amount of breast tissue compared to the fat tissues. This can increase the risk of breast cancer. And the next one is reproductive history, that is when a woman starts menstruation or when the person starts menopause. This could be a contributing factor. Did this person start menstruation earlier than expected, or did this person start menopause earlier than expected? This could be a contributing factor to breast cancer. And another risk factors of breast cancer is the use of alcohol. Yes, the use of alcohol, the use of drugs, and also when a person has been diagnosed of breast cancer, like previous diagnosis of breast cancer or previous treatment of breast cancer, this could also increase the risk of getting breast cancer. Another risk factor is tobacco use and also radiation exposure. This could be a contributing factor to breast cancer. Now, having said all of this I have mentioned, what are the tips to lower the risk of breast cancer? Number one is self-breast examination. Some of us, we don't even bother checking our breast. We just wear our bra and then go to work. That is it. We should be, checking our breast every day. Yes, at least try to create time for yourself to always check your breast to know if there's anything wrong, so that you will be able to, raise an alarm early enough, because early detection saves life. Self-breast examination is number one key to actually know if a person is having breast cancer. So how do you carry out self-breast examination? Stand in front of the mirror, check for the size and shape of the breast to know if there's any, difference in the shape or the size of the breast, and also check for any discoloration of the breast. If the breast, is becoming yellowish, reddish, or anything, or any rashes around the breast, just make sure you do your normal examination. Just, basically checking if there's anything different, from what you know about your breast. So now that you have done that, you can start from the right, you can also start from the left. Now, raise one of your hand and then bring out three of your fingers to check, palpate around the breast from, underneath the breast to the top of the breast, and also underneath the armpit as well, in a clockwise manner. Make sure you palpate around the breast and also the nipple. Palpate everywhere around it, just to know if there's any, abnormalities, if there's any lump, if there's any swelling, and check the nipple if the nipple is inverted. Now, how do you know if your nipple is inverted? Of course, you should know, because when the nipple is no longer, pointing forward and it's not inward, you should know that yes, this is not how a nipple should actually look. So raise an alarm, and early detection saves life. Raise an alarm, call your doctor, go and carry out series of tests to know if there's anything wrong. I'll I'll be showing us how an inverted nipple looks using an apple. For example, if your nipple is usually like this, pointed, right? And then when you are examining yourself, you are checking, carrying out your self breast examination, and then you notice that the nipple is now like this, inverted, is not pointed as just the way this one is pointed at, like is now, something like this is now inverted. So make sure you raise an alarm and say, this is not how my nipple looks now, it's now inside. So make sure you raise an alarm, to get tested for any form of abnormality or any form of cell growth around the breast. Another tips to lower the risk of breast cancer is reducing smoking. If you are here and you love smoking as a lady, please try and reduce the rate at which you smoke, so that you would reduce the risk of breast cancer. Okay, so reduce the rate at which you smoke, or even stop completely if you can. I know some of us cannot, but let's try and reduce it before we can finally stop. Another tips to reduce the risk of breast cancer is going for screening. Some of us, when they invite us for screening, for example, cervical screening test, or breast examination screening, all those stuff, when they invite us, we don't even when it's free, we don't even go, we don't leave our house. But when they invite us for 12-hour shift, we go. Yes, now we will go and make money. But please, while making money, make sure you also take care of yourself. Health is wealth. Another tips to reduce the risk of breast cancer is avoiding refined sugar. Yes, avoid refined sugar. This could also be a tip to reduce the risk of breast cancer. And maintain a healthy weight. Yes, maintain a healthy weight. Okay, ensure you eat enough vegetable like broccoli. So this could actually help you to improve your immune system and help to fight against any form of abnormality or any form of cell growth. Now, ensure you avoid any form of radiation exposure. Yes, because we basically do not know the main cause of breast cancer. So we are just trying to reduce any risk factor of breast cancer. So if you have any more factor that could reduce breast cancer, drop it on the comment section for all of us to learn. We are all learning, so your information might save someone's life. Thank you very much for watching. I hope you find this video very interesting. See you all in my next video. Until then, bye.
JMC CONSULT.